Listo.
Hello, very good afternoon to you all, and thank you for being here. This is a paper by Omar Stabridis and myself. Omar is a professor at COLEF since about 1 month ago, so congratulations, Omar, on
Thank you.
your new position. And I am a professor at CIESAS Occidente in Guadalajara. Since 4 years ago, we have been doing research on farm workers in Mexico's export economy. In this case, we will be speaking for the first time with data that we got this year, and that allowed us to have new questions on COVID, with workers in northern Mexico, specifically in Baja California. So allow me to start. And if you have any questions, just well, put them on the chat, please. And we can discuss this when we finish talking. Okay, well, farm workers in Mexico have traditionally been among the lowest socioeconomic groups. For many decades, even centuries, they have mostly been indigenous peasants, poor indigenous peasants from Mexican indigenous communities who migrate seasonally to work in commercial agriculture elsewhere. So they come out of these traditional indigenous communities, they go to work somewhere else, and they go back to those communities. That picture is changing because they are less and less the owners of land in those peasant communities. Only 8% of Mexico's current farm workers actually own land anywhere. So they're mostly a proletarian group. However, that's how they have been for many, many years. And because they migrate from the south to the north, they are very often conceived as a nomad population. Since working conditions for them have normally or historically been extremely bad, they have been called nomads, not just because they migrate, but also because they have no home. In other words, they may go back to their communities in southern Mexico, but they may not have a home there. They are actually staying with relatives or borrowing land from somebody to establish to build a small house. And so that's one of the reasons why they are thought of as a very vulnerable group. The average incomes of farm workers have been among the lowest. So they have traditionally been below the unskilled informal wages of workers in Mexico's urban informal economy. They have also migrated in unacceptable conditions. There are many pictures and many analyses of farm workers traveling in trucks, in freight trucks, in open air freight trucks, in which accidents basically very easily kill them. And finally, their living conditions have been denounced, especially in a number of articles starting in 2014. They were shown to be living in what you could call horses' pens or cattle pens, very small spaces with a tin roof above, but basically nothing really is purposely built for beds or for tables, etc. However, starting in 2015, their working, their incomes, and their living conditions have improved very, very much, to the highest level ever recorded. And what about COVID? Well, in the US, Latinos have been shown to have suffered COVID to a greater extent than non-Hispanic whites, and even to a greater extent than African Americans, especially when you control it by age. This, at the beginning of the pandemic, you had to control by age to arrive at higher rates for Hispanics. And right now, actually, you can see that there are higher rates throughout the population as a whole. Also in Mexico, 71% of all fatalities, all COVID fatalities, took place among people with less than 7 years schooling. Sorry. So lack of schooling seemed to be one of the traits associated with higher fatalities. So if you combine this low socioeconomic standing and the fact that COVID seems to have hit mostly the lowest socioeconomic groups, including Hispanics in the US, then farm workers in Mexico should be among the worst hit groups. Nevertheless, Martin in California finds that farm work has been relatively safe, due both to the nature of the workplace, in which workers basically work in the open air, they remain distant one from the other, and now they wear masks, but actually they have worn masks for a long time, and to specific COVID protocols. Basically, what employers did with farm workers in California is that they had small groups living together, interacting among themselves and not interacting with the rest of the world. And therefore, they seem to have been successful at keeping infection at fairly low rates among these farm workers. And these practices are the exact opposite of those in meatpacking. If you look at a number of news items on farm workers, they're actually talking about food workers and mostly about food workers within plants. That is to say, in packing operations or in meat packing. And especially in meat packing, workers are working very close together. All surfaces are cold, and we know the virus survives for a long time on cold surfaces. There is crowding at work and during transport, and infections among them were in fact very, very high. But on the fields, they seem to have been lower. So this basically brings us to two possibilities. One is that migrant farm worker health levels and COVID infections may reflect their very vulnerable condition and their very disadvantaged origin. And therefore they may be showing the highest rates of chronic diseases and COVID. Or else they might show the same kind of positive gap to the native population that Hispanics traditionally showed in the US. That is, significantly better health levels upon arrival with a gradual worsening over time. And basically the book that I first read about this subject and that impacted me quite significantly was David Hayes Bautista in 1990. It is called The Burden of Support: Young Latinos in an Aging Society. In this older literature, health levels upon arrival and better habits explain recent migrants' better health. Therefore, in this presentation, what we intend to do is to determine within a random sample of formal workers in Baja California, Mexico. By the way, just one little thing about Mexican geography. What we call Baja California is the northern half of the peninsula of Baja California in Mexico. The southern half is called Baja California Sur. So we will be talking only about the northern half. But basically there we will be discussing, and that is the state in northern Mexico with the largest population of farm workers. So it's extremely important in terms of its farm worker population. And we will be talking about the association between health and COVID rates and migrant status and of course comorbidity, such as hypertension, diabetes, and migrants' heart conditions, A little bit about the survey. This, for the past 4 years, as I said, we have been researching this subject. And in 2019 and 2020, we carried out the first random stratified representative sample of farm workers in Mexico's export agriculture. Actually, that was a feat. I mean, nobody had done it before. It is difficult, but it is possible, and I think that's a very important thing that we did. That survey consisted of 3,600 workers, as I said, randomly chosen from firms employing a total of 83,000 workers out of an approximate 1 million workers in export agriculture. Actually, we believe that's an undercount, but let's leave it at 1 million. In 2021, we changed the questionnaire a little bit, and we interviewed an additional 963 workers in Baja California's 2 main agricultural valleys. The firms they work for employ basically 20,000 workers in all. The 2020 census reports 53,000 farm workers in Baja California, but that's an undercount. And the survey included 5 new questions on COVID. Well, why workers in Mexico's export agriculture? Somebody could think that we're speaking about a vulnerable group, but one that is becoming smaller, a population that is slowly disappearing. That is incorrect. Mexican agricultural exports to the US are booming. Basically, they have risen by 800% in terms of volume and by 1,000% in terms of value over the past 20 years. So growth has been extremely dynamic. And together with exports, of course, jobs are also growing. And I was just saying that farm workers' conditions had actually improved. But in Mexico as a whole, labor income for the population as a whole has fallen significantly. The first moment during which it fell is, and that's the lump, the right side of the lump at the left here, is the Great Recession, basically when Mexico's export economy suffered a significant slump. But what you can see here is that incomes have continued to fall all the way until the end of the graph, which is 2020. Sorry about the months here, but you will see them in the next graph. So real incomes for most of Mexico's workers have been falling for the past 15 or 16 years. But on the contrary, and this is farm workers' incomes all over Mexico, the national average, farm workers' incomes, on the contrary, have fallen until 2011, and then they began to rise. And they have come at the end of 2020 to a level that is higher than it's ever been recorded in a specialized survey like this one. And basically what happened here is that we had very large levels of Mexico-US migration from Mexico's rural areas. When those levels of migration fell very significantly during the Great Recession, then we had surplus population in rural areas in Mexico looking for jobs. And therefore, working conditions, because of market conditions, deteriorated very rapidly. However, starting sometime in 2013-14, wages begin to rise. They begin to rise very clearly in 2016, and they come to their highest level ever in 2020. And in the states in which export agriculture is strongest, there you find that wages are higher and they rise faster. So the labor market has been tightening in states in which exports are higher, as you could expect, because exports are rising. Agricultural exports are growing by almost 10% per year. So that does require much more labor. In the survey that I was describing a moment ago, that we call NJOREX, the one that we did in 2019 and 2020, which is a national survey of the main export crops, we found that in the companies affiliated to export associations, wages are even higher. And the wages that we found are basically the same that you would find in an automotive manufacturing plant for a semi-skilled or unskilled worker, not for a skilled worker. And these are the wages, these are pesos. In terms of dollars, pesos, there are 20 pesos to a dollar, to a US dollar. So that's about 380 US dollars for men in berries and 330 for women in berries, and the rest goes like that. In avocados, we found the highest wages. Avocados are also booming. And all of these are slightly above the national mean. Omar?
Yeah, the avocado is the wage is seasonality, because nada más is the when the cut and the low season. It's very different, the wage only.
Yeah. Well, yeah, the seasonality of wages in the states which export avocados is perhaps the largest one. So wages can be very high, and this corresponds, these wages that we're showing correspond to the end of the export season, so the end of the peak season, and you would get much lower wages during the non-export season. But the non-export season is becoming shorter and shorter. Through biological improvements and biostimulants, growers are being able to export almost throughout the entire year now. Okay. And it's not just wages that are higher. Job benefits in export agriculture in our survey are also much higher than in the rest of the Mexican economy. You find very high coverage of annual bonuses that in Spanish we call aguinaldos. You have a fairly high percentage of workers who report getting paid days off work. You have almost 100% registered for IMSS's medical service. 1/3 in the housing fund, and this should be just as high as the IMSS fund, so that's a problem. And the rest is smaller. Actually, you have more workers reporting using formal firms' childcare facilities than you have workers reporting the use of Social Security IMSS childcare facilities, which shouldn't be the case. Every worker should have access to childcare at IMSS, because that is part of the Social Security package that is being paid for by employers and by workers in Mexico. And below, we are showing what we call the actual benefits. And this is the answer to when we asked workers, do you really have access to these benefits? Can you actually get cured? Can you actually put your child in that child care facility, etc.? And these are the answers that we got. They're of course lower because they haven't all used all of these benefits. In particular, the housing fund is extremely low, and the use of child care facilities in the Social Security Administration is extremely low. But as you can see, these are fairly high, and they are higher than in the average, than in the rest of the Mexican economy. In this sample that we collected this year, and actually we finished collecting it only last month, so this is our inauguration, or this is the premiere. We have a slightly lower percentage of women working in Baja California than in the rest of Mexico. It's 46% in Mexico, it's 42% in Baja California. Age is the same as throughout the country, and workers' schooling is about the same, a little bit lower in Baja California than in the rest of the country. Schooling is lower among permanent immigrants. And this is important because permanent immigrants will not behave in a linear way in the rest of the presentation. So they have only 5.9 years of schooling, but they're also older, which we believe explains a little bit that difference. And a higher percentage of the workers in Baja California speak an indigenous language. So a higher percentage there is in fact indigenous when you compare them to the population in most of the other export states. And that also corresponds to the fact that more are migrant. Only 20.9% of the workers that we interviewed were native to Baja California, as opposed to a vast majority of immigrants, more than 40% permanent immigrants, and the rest temporary immigrants. And earnings in Baja California are the highest that we have found ever. So almost 12,000 pesos, almost almost $600 a month for the native born in Baja California, and a little bit less for the other categories. These differences, the fact that we are dealing with a better paid subpopulation of farm workers in Baja California, they reflect some of the regional differences. Number one, a process in which agriculture developed in a social void. There was no traditional agriculture where now you have export agriculture in San Quintin. Or if there were a few fields. There were colonies in the 19th and early 20th century, but really they produced extremely little. Agriculture developed in isolation in this part of northern Mexico. So basically you had to bring everything in. A lot of things in that kind of agriculture have been imported mostly from the US. And that's one of the reasons why academics call this kind of economy an enclave economy. So one that is not related to the rest of the Baja California economy. Actually, things have changed and there's a lot more relationship now, but that was the case for at least 30 years. Also, the towns are quite new. As opposed to Jalisco, where basically old towns are growing because of export agriculture, in this part of Mexico, the towns grew from nothing. San Quintin, which just became a municipality, it didn't used to be, is Mexico's largest farm worker town. And finally, because you had such a large population coming together very rapidly, and because working conditions were unacceptable, this region was the seedbed for Mexico's most important farm worker protest movement. Workers effectively stopped traffic into and out of the valley, and they had their union recognized. These are the levels of chronic disease in workers' households. As you can see, the highest percentage of diseases that we find is basically being overweight. And this is something that characterizes natives and permanent immigrants, but much less temporary immigrants. And if you go across the table, you will be able to see that the prevalence of all these diseases is much lower among temporary migrants than it is among the other two groups. Remember, permanent immigrants are a little bit older, so their age actually contributes to them being a little bit sicker than the other groups. Now, the question is if these differences are the same in the case of COVID. And we will do that, we will divide that in terms of two comparisons, the native born against permanent immigrants, and then the native born against temporary migrants. COVID is slightly more prevalent among natives than it is among permanent immigrants. The difference isn't so large, but it is very significant. And in terms of suffering COVID himself or herself, the worker, the difference is larger, and it is also extremely significant to 0.01. So basically, this is a very good indication that there is a real difference between these two groups. And actually, the differences are even larger when you compare natives with temporary immigrants. And this is really something that is quite remarkable, because temporary immigrants have lower income for the rest of the year than much lower than natives. They also travel in crowded conditions. They live in crowded conditions in southern Mexico, and they tend to live in company lodgings in Baja California, which you could think as crowded spaces in which infection is actually much more likely. Well, when you look at this table, you find that the difference between the incidence of COVID among the native-born and temporary immigrants is extremely large. It is extremely large and very significant. So what we find, in few words, is that the population we are looking at resembles the case of the Hispanic population arriving in the US to a much larger extent, and it conforms to that vision much more than it would conform to a vision of vulnerability affecting these groups the most. There are limitations to this, and I would like to leave that to the audience to actually glean them out. But we would just like to finish by saying that first, we detected two similar differences, so differences moving the same way, between workers according to their migration status. Temporary migrants show better health in general than natives, or at least show lower levels of chronic disease than natives. And temporary migrants are significantly less affected by COVID than natives. Permanent immigrants, as you could expect, are somehow in between, but they are much closer to the epidemiological profile of natives in terms of their health levels in general and the prevalence of COVID. We were trying to establish whether two factors were responsible for this, for these differences. And number one, we found that workers respond that COVID protocols have been implemented in the firms where they're working. Less than 1% report that there's that they have been faulty or that they were implemented late. So conditions at the firm, sanitary conditions at the firm, doesn't seem to explain the difference in these COVID rates. And finally, temporary migrants are the ones, 70% of temporary migrants live in company lodgings or in company housing. And they are actually associated with far less COVID. Sorry, it says here 41% use company housing. And actually company housing is associated with less COVID, not with more. So I would just like to finish now and ask, first of all, Omar, if he has anything to say before we open it. Omar?
Yeah. Oh, this is oh, I went to the questions for her.
Okay, fine. Excellent. So we're open to questions now. Chloe?
Yes, I don't see any questions for now.
Yeah, oh, there's one.
Yes. Can you see the question, Agustin, or would you like me to read them?
No, I can see it, but maybe I
Okay.
should read it for the rest of the audience. Could the difference in incidence be at least in part behavioral? That is to say that migrant and temporary workers would spend less time in the community and or would not mingle as closely with the rest of the community. Omar, would you respond?
Yes, I don't know I don't see the questions. Please, thank you. Don't.
A ver, que si la
Lo puede-
diferencia puede ser explicada en términos conductuales. Es decir, que los migrantes temporales pasen menos tiempo en la comunidad o que no interactúan tanto con la comunidad.
Ok, eso es, sí, es que yo no, esa pregunta te la hicieron a ti directa.
A los dos.
Yo no la, es que no estoy viendo el chat. Fíjate. Ah, ya. A ver, espérame un segundo. You can ask. Okay. Ah, the difference is the temporary migrant versus local. Okay, this is possible that in COVID, it's possible that the temporary migrant place more time in the housing companies, and not that it's possible that they follow the respect to the protocols for COVID, and not and uh, no for COVID respect to the local people, because local people, the local workers is more interactive with the other people, no, with other people, because for example,
okay.
the neighbors. Mm-hmm.
Yeah, exactly. It could be that the fact that they are housed in a closed space, because they're mostly housed on company property, means that they have less interaction with the community. I agree with Unger. And it's also a little bit paradoxical, because they spend more time in crowded transport from southern Mexico to northern Mexico. So there are factors that explain that help to explain a lower prevalence, but also some that would lead to a higher prevalence. Nevertheless, as we saw, it's much lower. Any other questions? Welcome.
Okay.
Okay. Well, there is one, and if you check the program, you will see that we had ethnicity also as a variable that we were going to relate. And this is something that we'll do in the next paper, but ethnicity actually behaves in a way that's very similar to temporary migration, because most temporary migrants, so the highest prevalence of indigenous groups is among temporary migrants. Also, there is also a large percentage of permanent immigrants who are indigenous and who still speak indigenous languages, but the highest percentage is among temporary migrants. So the differences will behave in a similar way. Another thing that we did not do in this presentation, because basically it was not highly significant, is that we did a regression with age, because we thought age would explain a lot. And actually it doesn't explain that much. So there is a significant difference in terms of migrant status, and that remains even when you do a regression with most of the usual variables. Any more questions? Chloe, over to you.
No, I don't see any more questions, Agustin. I don't see any raised hand yet either.
Oh, you're right. There could be raised hands.
Yeah,
Okay.
I'm checking that.
Okay.
Uh-huh.
No.
No.
Usually oh, I see one raised hand. So Philip Martin.
Oh, hi, Phil.
I got And now maybe you can hear me. Great presentation. Yes. Thank you. Can you comment on the low COVID in the employer provided housing? It's become an issue among H-2A workers in the United States because the basic idea, if you're an employer, you say you're doing it for the workers' own good. You're controlling the workers. You're keeping them, apart from the community so that they don't have the chance to go to fiestas and get COVID and stuff. If you're taking it from the worker point of view, then of course you're saying the employers are in control, and whether it's for the workers' own good or not, it highlights the control that employers have over workers in their own housing. Is there any kind of a similar discussion in Baja? I mean, in the sense that the employers set the health protocols and they discipline people who don't obey them. And in this case, it sounds, I mean, at least in parts of the H-2A program, it seems to reduce the amount of COVID. I think your overall story of relatively little COVID, especially among workers housed by employers, is a real story. And when we think about this, do we weigh this as, well, that shows how much control employers have and they implemented these protocols, or how do we think about it?
I actually haven't done work personally in Baja California. I'm traveling on July the 11th. Omar has been there, and we are doing field work with a number of field workers there right now. What I can tell you is that workers are the most active in Baja California. So I would expect that even though there is a measure of control by employers over company housing, no question about that, but that they have come to some sort of understanding with the workers so that they can come in and out at certain times, etc. But it is a fact that in the past, being, let's say, confined to company lodgings and to a company's property has been a very contentious issue in Baja California. I couldn't tell you right now because, as I said, I'm just traveling soon there, but I haven't done it. But we'll be finding out.
Yeah, and Agustin, and in supplement for your comments, and the companies in agro-export companies in Mexico, Jalisco, remember the last year, and Jalisco, Michoacán, and Baja California adopted protocols for COVID quickly. Just the face masks is the rules, strong rules, and then is the
washing hands.
Washing hands, and the take alcohol for their hands, and the social distances even in the bus, no, and the bus to transport to the workers, and I remember that the protocols is cartels in the.
But they're posted.
Yes, posters. All the companies, for food, in the place, in the field. Yes, entonces the conscientization of the COVID for workers was were success, no? This is in my opinion, and the temporary migrants is suffer the economic problems because need to go to Baja California or Jalisco and need to the more conscientized respect to the local workers, if it's possible. Pues, no, o sea, o sea, como que eran más conscientes en el hecho de que ya tenían para viajar, tenían que tener o sea, tenía que tener mucho más precauciones.
Okay, well,
no,
yeah. living in a space which is highly, what Omar is saying is that protocols were followed very quickly. Actually, at the very beginning, you could say that employers in Mexico almost panicked. They did lose a part of their workforce because of COVID. Workers didn't want to be infected, and they went back to their communities in southern Mexico. And the protocols were implemented fairly quickly, not just because the health ministry said it, but also because workers were afraid. Employers needed to have the protocols in place to actually keep the workers working. And they seem to have been effective. So if you consider that using company housing actually implements those protocols also where the workers live, then the outcome that we found is makes a lot of sense. Thanks, Phil. Now, good to hear you.
Good to hear you. I mean, if I'm still on, let me just sort of say that one thing that people said here, and it sounds like it might also be true in Mexico, is if you worked in a meatpacking plant, the chances are and got COVID, the chances are you got it at work and took it home. If you worked in the open field agriculture and you got COVID, the chances are you got it at a fiesta away from work and might have brought it to work. In other words, you know, from meatpacking, they say the COVID kind of went out from the workers. And from agriculture, sometimes it came in from the workers when they had, that's why they said in the H-2A workers, it was less common because they prohibited soccer games, they prohibited any kind of social, whereas you could not control that kind of behavior for the workers who lived off-site that weren't under the control of the employers. That's at least what people say.
Yeah, I think that's an interpretation that makes sense. We would like to see whether or not these rates are actually higher than among the general population of Baja California, or than among the general population of the towns of San Quintin, for example. Because we know Tijuana was very, very seriously infected. But we haven't done that yet. We'll do it sometime in the future. But as you can see, the rates of infections are not that low. They're actually 2% for temporary migrant workers, for the workers themselves. But we need to check. And of course, the reference to the worker's household doesn't give you a valid population parameter. We would have to have the same question among another population.
Okay.
Yeah. Well, thank you.
Thank you.
Chloe, would you like to jump in?
Yeah, I don't see anything new, Agustin.
Nor do I.
So yeah, don't be shy. Feel free to ask your question. The session will be ending in 15 minutes. So if you have one, now is the time. Sorry, I made a mistake, not 15 minutes, 30 minutes, my bad.
Yeah.
I'll raise my hand again. If I can ask again until other people have questions, can you say something about the profitability of the Baja agriculture? In other words, my sense is that producing some of the commodities in Mexico to export to the United States has been pretty profitable. I've been told that berries coming out of Baja hit the market at a certain time so that the profit margins are much higher than the profit margins, let's say, from berries out of Salinas and Watsonville. And it's not just lower wages or higher yields, it's the time of the year when the berries come onto the market because the market price goes up and down. I mean, do we have any sense of the profitability? I know there also grow vegetables, tomatoes and things there. Do we have any sense of the profitability of the agriculture in Baja and whether it's going up or down or anything, which allows the employers in part to provide the higher wages and the benefits. I mean, they have to because the cost of living is higher, but it also might affect, what's the profitability like?
We don't have information on profitability yet. We will have it, but at the time we don't. As you know, this is one of the most guarded things in the industry, because basically they don't want US buyers to begin buying at lower prices. So it's very strictly kept, but we will be finding out much more about that fairly soon.
Yeah.
Okay. Okay, Chloe, I think that if that's it, then we can thank you all for being here. And well, if you have any questions, does Metropolis publish the email addresses of the presenters, Chloe?
No, we haven't planned of doing that. However, if you would like to, you can put it right now in the chat to share with the attendees.
Sure. Let me, whoops.
For your information, also the recording of the session will be available after the forum. So we will share the link with all the registrants. You will receive an email after the forum.
Okay, that's mine. And well, if you write to me, I'll forward it to Omar. There's something my okay, there it is. That's my email address.
Okay.
And I can pass it along to Omar if you write to me.
Yes,
I just see Omar's email address.
Yes, Gmail, yes. Stabridis. Oh, easy in the chat.
¿Por qué no lo escribes? Yeah, it has it.
No, ya lo escribí.
Okay, perfecto.
En el chat.
Okay.
Para todos los panelistas.
Okay.
I don't see your email address, Agustin, in the chat. Is that normal?
Yes.
Tú no se ve, Omar.
I see Omar. I see Omar's email address, but not yours, Agustin.
Oh, that's funny.
Mm-hmm.
Yes. Or my another email.
Okay.
Okay, now I see both of Omar's email address.
Agustin, yours is in the Q&A.
Oh.
Okay. Yeah. Oh, yeah. Sorry, that's how I did it. Yeah.
Oh, yeah, right. Okay, I'm going to add it right now.
Okay. Well, thank you very much.
Thank you.
Thank you.
Good job.
Thank you. Bye-bye.
Thank you. Bye.
So I just added Agustin's email in the chat. I'm just going to close the session in 30 seconds for those who would like to copy and paste it.
Okay.
And I think we're good. Thank you. Going to close the session. Thank you, Agustin. Thank you, Omar.
Thank you very much.
Have a good day.
Thank you very much.